What if everything you've been told about your back pain is only part of the story? What if the discomfort you feel every single day when you wake up, when you stand, when you try to sit comfortably, isn't actually coming from your lower back at all? Stay with me, because what you're about to hear could completely change how you understand your pain. And quickly, before we go deeper, drop your age and the city you're watching from in the comments. I read them all, and it helps me understand who I'm speaking to. I'm Dr. Michiel Kent, and after years of working with patients who were told their back pain was normal, I started noticing something that most people, including many doctors, completely miss. People were treating the location of pain, but not the source of it. They were focusing on the lower back because that's where it hurt, but their body was telling a much bigger story. Let me explain this in a way that will immediately click for you. Your lower back is not an isolated part of your body. It doesn't operate alone. It is part of a system, a connected chain that includes your hips, your core, your legs, your upper back, and even how you move throughout your day. When one part of this chain stops working properly, another part takes over, and most of the time, that other part is your lower back. Now, here's the problem. Your lower back was never designed to carry that extra workload. It's built for stability, not for compensation. So when it starts doing jobs it shouldn't be doing, it begins to tighten, fatigue, and eventually send pain signals. That pain feels like the problem is in your back, but in reality, your back is just the messenger. And for many seniors watching this right now, this might be the first time your pain actually starts to make sense. Let's go deeper, because this is where everything changes. There are 5 key areas in your body that are directly connected to your lower back. And when any one of them becomes weak, tight, or restricted, it pulls on your lower back in a way that creates real, persistent pain. The first area is your hips. Over the years, your hips lose mobility. Sitting for long periods, reduced activity, and simple aging all contribute to this stiffness. When your hips stop moving the way they should, your lower back is forced to move more to make up for it. Every time you bend, twist, or even walk, your back is doing extra work. Over time, that extra work turns into strain, and that strain turns into pain. Think of it like this. If a hinge on a door stops working, the frame begins to take the pressure. Your lower back is that frame. It absorbs the stress that your hips can no longer handle. Now, the second area is your glutes. These are the largest and one of the most important muscle groups in your body. They're responsible for helping you stand, walk, and maintain posture. But in many older adults, the glutes become inactive. They switch off due to years of sitting or lack of targeted movement. When your glutes stop doing their job, your lower back steps in. Every time you get up from a chair, every step you take, your back is working harder than it should. And over time, that constant overuse leads to fatigue and discomfort that feels deep and persistent. The third area is your core, and I want to be very clear here. I'm not talking about visible abs. I'm talking about deep internal muscles that act like a natural support system for your spine. These muscles stabilize your entire midsection. When they weaken, your spine becomes less supported. Your lower back senses this instability and tightens up to protect you. That tightness is not random. It's your body trying to keep you safe. But the longer it stays tight, the more uncomfortable it becomes. Eventually, what started as protection turns into pain. The fourth area is your hamstrings. These muscles run along the back of your thighs, and they have a direct effect on your pelvis. When your hamstrings become tight, which is extremely common as we age, they pull your pelvis out of its natural position. This changes the alignment of your spine and places constant tension on your lower back. You might feel this when you try to bend forward or when you sit for too long. That pulling sensation isn't just in your legs, it's affecting your back in a very real way. And the fifth area, which is often completely ignored, is your upper and mid-back, your thoracic spine. When this part of your spine becomes stiff, your body compensates by increasing movement in your lower back. Once again, your lower back is doing more than it should. Do you see the pattern here? Your lower back is constantly stepping in to compensate for other areas that are not doing their job. Now, here's where things get interesting. When patients start addressing these 5 areas instead of only focusing on their lower back, something begins to shift. The pain doesn't just decrease, it starts to make sense. I've seen people who struggled for years, people who tried medications, physical therapy, even injections, finally experience relief when they stopped treating the symptom and started addressing the cause. But let me be very honest with you, this is not about a quick fix. It's not about doing one stretch and waking up pain-free tomorrow. Your body didn't develop this pattern overnight, and it won't reverse overnight either. What it requires is consistency, small intentional movements done regularly, gentle stretching to release tight areas. simple activation exercises to wake up weak muscles, and most importantly, awareness of how your body is moving throughout the day. Let me give you an example. If your hips are tight, even something as simple as slowly opening and rotating them each day can begin to restore movement. If your glutes are weak, practicing controlled standing and sitting movements can start to reactivate them. If your core is unstable, learning how to gently engage those deep muscles can provide your spine with the support it's been missing. These are not extreme changes. They are small adjustments that begin to shift how your body functions as a whole. And over time, those small adjustments create real results. You might notice that getting out of bed feels easier. Standing doesn't feel as exhausting. Walking becomes smoother. Sitting becomes more comfortable. These improvements may seem small at first, but they are powerful signs that your body is starting to rebalance itself. Now, I want you to think about your own experience. How long have you been dealing with this pain? How many times have you been told it's just part of aging? How many solutions have you tried that only gave temporary relief? What if the reason nothing has fully worked is because the real cause was never addressed? Your body is not failing you. It's adapting. It's finding ways to keep you moving despite limitations in other areas. But those adaptations come at a cost, and that cost is the pain you feel in your lower back. The good news is, once you understand this, you can start to change it. You can begin to move differently. You can begin to strengthen what has become weak. You can begin to release what has become tight. And slowly, your body starts to shift out of that constant state of compensation. This is not about perfection. It's about progress. Even a small improvement in mobility, strength, or posture can reduce the load on your lower back. And when that load decreases, your pain begins to decrease as well. I've seen this happen again and again. People who felt stuck begin to feel hopeful. People who avoided movement begin to regain confidence. And people who believed their pain would never improve begin to experience real change. But it all starts with understanding. Understanding that your lower back is not the enemy. It's not the root cause. It's the part of your body that has been working the hardest to keep everything else functioning. And now it needs your help. So instead of focusing only on where it hurts, start asking why it hurts. Start looking at the bigger picture. Start paying attention to how your body moves as a whole, because once you do that, everything begins to connect. Your hips, your glutes, your core, your legs, your upper back, they are all part of the same system. And when that system starts working together again, your lower back no longer has to carry the burden alone. That is when real relief begins. And I want you to remember this. No matter how long you've been dealing with this pain, your body still has the ability to adapt. It still has the ability to improve. It still has the ability to feel better than it does right now. You are not too late. You are not too far gone. You are simply missing a piece of the puzzle that no one has shown you before. And now you have it. So take this seriously. Start small. Stay consistent. Pay attention to how your body responds. And give yourself the chance to experience what happens when you finally address the real cause of your pain. And before you leave, don't forget to comment your age and your city below. I genuinely want to hear from you and see how many people this message is reaching.